Welcome to Business Talk, a global podcast series where we bring you closer to some of the world's most distinguished scholars and their impactful ideas. I'm Deepak, your host from India. We are delighted to welcome Dr. Hoang to Business Talk today. Before we get started, I would like to introduce the guest for today's episode. Before she was guiding researchers and shaping the future of management at ESSEC Business School in Sergi, Dr. Hoang was already captivated by a simple but powerful question. How do ambitious ideas become thriving ventures? Over time, that curiosity pulled her into the heart of strategic alliances, employee entrepreneurship, and the evolving identities of founders as they build and grow their organizations. In industry after industry, and especially in biopharma and other knowledge intensive fields, she has followed the journey from first handshake to breakthrough innovation, showing how partners learn from one another, navigate uncertainty, and turn experience into new products and new markets. Her work has traveled far beyond the classroom, appearing in leading journals such as Strategic Management Journal, Administrative Science Quarterly, Academy of Management Journal, and Journal of Business Venturing, and inspiring scholars who study social capital collaboration and entrepreneurial identity. She has not only written about these topics, she has helped curate and refine them through her editorial roles at Organization Studies, Strategic Management Journal, and Strategic Entrepreneurship Journal, and through her leadership at the Strategic Management Society and the Academy of Management, where she has contributed to building communities of researchers around the world. At ESSEC, Dr. Hoang has worn several important hats, head of the management department and now Associate Dean of Research, roles in which she has championed rigorous, impactful scholarship and mentored doctoral students working on biopharmaceutical ventures, ecosystem strategies, and cross-sector collaborations. Her academic journey shaped by formative years at the University of Chicago and the University of California, Berkeley, and by appointments at Case Western Reserve University, INSEAD, and ESSEC, reflects a lifelong engagement with entrepreneurship, innovation, and the delicate dance between competition and cooperation. Today, she brings that rich experience and perspective to Business Talk, joining us to share insights from her research on physician entrepreneurship, a study of early career physicians, founding motivations and actions. As we listen to her stories and findings, we'll step into the world of early career physicians who choose to become founders and explore what their journey reveal about entrepreneurship, identity, and the future of healthcare. Professor Wang, welcome to Business Talk. We're so glad you are here.
Well, thank you for inviting me and giving me the opportunity to practice what I preach in my role as Associate Dean for Research.
Thank you. Professor, what were the initial research motivations and methodological choices that led you to seek access to NHS Clinical Entrepreneurship Program and study physicians who were engaged in entrepreneurial projects?
Well, actually, based on prior work, I was really motivated to study entrepreneurial transitions. And it seemed that frontline physicians developing innovative projects would be a fascinating context to study. We thought that there would be some similarities with other types of entrepreneurial transitions. My co-author, Marcus Perkman, for example, studied academics engaging in entrepreneurship. But we were also really interested in the differences which had not been explored before. So we fortunately got approval to access the program at its founding. I was an observer at in-person program activities where I met participants. We also conducted follow-up phone interviews. And then we conducted a survey of the first two cohorts of the program to provide additional confidence in our findings.
Because you found that many physicians in the NHS Clinical Entrepreneur Program begin with an intention to improve the system. What did organizational improvement mean in practice for these doctors? And how did that motive shape the kind of ideas and ventures they pursued?
Yeah, many doctors in this program were early career physicians that were still undergoing their medical training, often in these specialist fields. And their ideas generally drew on their training and their experience in their local context that led them to say, wait, I think we can do this better, right? Their training so informed where they saw improvement opportunities. And then they also drew on their own interests typically in new technologies or their personal background, to propose solutions that they thought were more effective than what they were observing. And so the projects, these nascent, ventures, if you can call it that, focused on solving clinical problems, improving outcomes, or improving processes.
Professor, describe how entrepreneurial projects often started inside the NHS as entrepreneurial initiatives, then shifted to individual level resourcing and sometimes company formation. Can you walk us through a typical journey from a clinician noticing a problem to an internal project to an external venture?
Yeah, it was helpful for us to think of these physicians as employees of the NHS, which was investing in them by providing training and clinical experience. Viewing them as employees actually helped us to better understand how they attempted to navigate within the organization to advance their projects. And this often centered around de-risking the project. So one doctor, for example, building on her training and interest, was developing an electronic dashboard that could help clinicians during the time, during the moment of cardiac arrest, and other types of emergencies. What she noted with this project that there were barriers, including a lack of time by clinical leaders, to champion the project, and limited funding, resources, and pathways to experiment and then scale it beyond the pilot. She was well aware of this, and she turned to a head of a software firm as a co-founder to access skills and resources. But she still needed to work with NHS frontline personnel for the testing phase. So I hope that gives you a flavor for a trajectory.
Professor, the concepts of role breaching and externalizing the opportunity are central in your findings. How did physicians experience the tension between their prescribed clinical role and their entrepreneurial ambitions? And what kind of concrete action did they take to breach those constraints?
Yeah, getting resources was such a significant task, so the notions of role breaching and externalizing the opportunity, which emerged from our interviews and observation notes, tried to capture how these constraints that I mentioned were, addressed. Certainly, their role as physicians, the traditional role was not to create innovative new ventures, right? Because that would take time away from the activities that improved their clinical skills and would lead to positive assessments and the certifications that they needed in order to progress. So one interesting example of role breaching that we heard from a number of clinical entrepreneurs was that they actually reimagined how they would have impact over their medical careers. Some thought about the number of patients that they would personally treat in their clinical practice, and then they compared it to the potentially wider impact that, say, a software solution would have that could be implemented across the entire NHS and the larger number of patients that they, would indirectly benefit. So for some, this change, in how they could have impact was very motivating, but it might mean that they would have to pause or slow their professional development in order to find the time to devote, to their project.
Professor, many of your participants express strong identification with the NHS. I love the NHS is one striking quote. Yet they also felt the system was rigid and bureaucratic. How did this deep organizational attachment coexist with dissatisfaction? And how did the combination fuel entrepreneurial behavior?
Yeah, my example earlier tries to give you a flavor for sort of that, that tension. And we were particularly interested in how physicians' attachment to the organization, which in this case was the NHS health system, was affecting the processes that we were observing. Program participants were very, vocal in their support for the NHS's mission, to provide healthcare irrespective of a patient's ability to pay, which is an incredibly important and valuable role or function of the NHS. But they, also noted that they were a cog in a big machine, as one person put it, which was a real hindrance to scaling a solution. So following our interviews, we conducted a survey which allowed us to get input from a wider population of participants. We asked them questions in the survey on their identification with the NHS, linked it to the extent to which they would consider leaving, perhaps to pursue their entrepreneurial venture full time. And while the results are purely cross-sectional, it was consistent. Our results was consistent with the idea that greater identification with the NHS was associated with lower intent to leave.
Professor, you highlight individual resourcing, where physicians bypass formal organizational channels to mobilize their own networks, funding, and collaborators. What did you learn about the kind of network and resources early career physicians drew on, and how did those choices affect their projects?
Yeah, we did find that personal connections were a resource that they turned to. But again, in the case of these early career physicians, the network was their personal network was not as rich enough, to support their projects typically. So some clinical entrepreneurs, interestingly for us, participated in hackathons or joined accelerators, to find team members and funding. And accelerators were actually very attractive as they could introduce the clinical entrepreneur to investors like VCs or corporates. Of course, this is how the NHS could lose its skilled doctors. So, in fact, the Clinical Entrepreneur Program borrowed some of these elements by, incorporating mentors, a pitch day, and the cohort structure, which created a format for meeting like-minded people. So it was intended to create a more supportive environment and increase access to resources beyond just, the clinical entrepreneur's personal network.
Professor, a recurring theme in the paper is the desire to preserve professional identity while experimenting with entrepreneurship. How did these early career physicians negotiate being still a doctor while becoming founders? And what kind of career redefinitions of hybrid roles emerged from that negotiation?
Yeah, our interviews allowed us to hear from some who were in this liminal phase. And the program was a context that, would help us to find individuals which would otherwise be very, very difficult to find. What we saw were that some individuals chose locum or part-time roles so that they could continue to practice medicine, but were not working in the NHS full-time. Some felt that gave them more control over their schedule. Others, went into research and took fellowships, which freed up their time as well. So the challenge, is that the traditional support systems were built for, the typical career trajectories. It should be, mentioned that the CEP program over time also provided support indirectly to these kinds of hybrid roles by communicating about the value these individuals were in fact contributing. So very interesting, different layers here in terms of what kinds of support were emerging for hybrids, for clinical entrepreneurs.
Professor, your survey shows links between role conflict, organizational identification, taking charge, and intention to live or stay in the NHS. If we step back from the statistics, what do these patterns tell us about the emotional and identity-based pressures physician entrepreneurs face as they build ventures?
Yeah, I think some of the quotes in the paper really try to capture some of the processes, the dynamics. But what's nice about the multi-method design is that we took the insights from our interviews and then conducted a survey using well-established scales that gave us more confidence that those who went beyond their health delivery role, and sought to initiate improvements or solve problems, this was the taking charge concept that you just mentioned, did have lower intentions to leave. On the other hand, the greater they felt that their activities conflicted with their professional role, the role conflict, the stronger were their intentions to leave. And so, with a cross-sectional survey, really, we, can't, tease apart the causal arrows here, but it does point to the motivation and the challenges of innovating in this context.
Professor, you argue that many projects could have followed either entrepreneurial paths, but the lack of systematic support for entrepreneurship pushed physicians outward. From your perspective, what would a healthcare organization need to change structurally or culturally to better support physician innovation from within?
One of the benefits of starting this study at the early stages of this program, it's interesting. Now that the study has been conducted, we've actually observed more structural changes. So, for example, in 2022, a complementary program called Insights was created to provide test sites at 18 organizations, mostly hospitals, with dedicated personnel who could shepherd projects and help scale beyond the validation stage and get wider adoption within the NHS. So this actually gives clinical entrepreneurs a complementary internal avenue for developing their projects, which had not been there when we conducted our study, and could reduce the need to go outside the system. But this obviously will not be very effective if the culture is not supportive of innovation. So I think it will be very interesting to watch whether program alumni, former participants, former clinical entrepreneur program participants, can affect cultural change. If they remain in the NHS and they themselves enter leadership roles, they could be a very interesting avenue for cultural change.
Professor, before we wrap up, one final question. Your work has implications beyond the UK and beyond medicine. For entrepreneurship in any highly professionalized, identity-driven context, what broader lessons do you think managers, policymakers, or educators should take from physician entrepreneurship about enabling innovation without undermining professional commitment?
I think it would be meaningful to build career pathways for clinical entrepreneurs who need more flexibility while encouraging them to keep a foot in clinical practice. The definition of professional commitment and the career ladders that are typically associated with that needs to be redefined and broadened. And space needs to be made for clinical entrepreneurs as a legitimate role. While I didn't study the clinical entrepreneur program explicitly, it is worth looking into for anybody, policymakers in particular, for anybody looking for implementable solutions. There's a lot that's very interesting and exciting happening there. It's now in its 10th year, so there's a long track record and maybe other practices which I haven't even described in the paper to look at more closely and maybe imitate.
Listeners, as we wrap up, I want to thank Professor Hoang for sharing such thoughtful and grounded research insights on physician entrepreneurship and the evolving role of doctors as innovators. Her work reminds us that meaningful change in healthcare often begins with professionals who care deeply about their organizations and are willing to step beyond traditional roles to improve the system for patients and colleagues alike. Thank you for listening to Business Talk. We hope this conversation sparks new ideas that how professional identity, organizational commitment, and entrepreneurship can come together to shape the future of healthcare. Thank you so much, Professor Hoang, for sharing your research insight with our audience. It was an honor to host you. Thank you so much.
Thank you. Thank you for having me.